This yoga guru's comments on modern medicine have outraged Indians on and offline.
लाखों लोगों की मौत एलोपैथी की दवा खाने से हुई है। जितने लोगों की मौत हॉस्पिटल न जाने के कारण से हुई, ऑक्सीजन न मिलने के कारण से हुई है, उससे ज्यादा लोगों की मौत ऑक्सीजन के बावजूद हुई है, दवा एलोपैथी की दवा मिलने के बावजूद हुई है।
Baba Ramdev has quite a following on social media, but it's not the first time people are shaking their heads at his remarks.
Ramdev has a reputation for making controversial, unscientific remarks. Earlier, he had mocked COVID patients looking for oxygen cylinders, and his most recent comments have now caused a huge outcry, especially from the medical community, which is still battling a ferocious second wave of infections.
The yogi withdrew his comments after criticism by India's health minister, and the Indian Medical Association is urging Prime Minister Modi to stop the misinformation campaign on vaccination by Mr. Ramdev. The yoga guru has also advertised a supposed COVID-19 cure, among a whole range of other ayurvedic products. Marketing Coronil as a COVID-19 remedy had to stop last year when the government said there is no data to prove it works. But recently, the state of Haryana announced they distribute the product for free to COVID patients.
Doctors are speaking out against this move, saying this sends the wrong message about how to treat COVID-19. This is especially dangerous at a time when the disease is spreading fast in rural areas where there are extremely limited healthcare facilities and misinformation and myths abound.
In rural areas, many are hesitant to get vaccinated for fear of negative side effects.
आमच्या गावातून 3 माणसांनी लस घेतलेली आहे. दुसरी माणसं घाबरतात लस घेण्यासाठी, म्हणजे असं लस घेतल्यावर काही म्हणजे माणसं मरतात काय असं त्यांचा गैरसमज होतो.
It is about 1 lakh people for people staying in this 25 villages. The vaccination center or camp which was put on for these 1 lakh people, no single person came from this 1 lakh and took the vaccination.
Hesitancy is only one factor hampering vaccination efforts. Medical facilities providing vaccines are often scarce, with the closest hospitals hours away. And only about half of India's population has internet access, making vaccination appointments hard to come by for many.
Rural areas are severely lagging behind the big cities. Lack of personnel and infrastructure is hampering the efforts to distribute vaccines to more remote areas. But there's an even bigger problem: a major shortage of vaccine doses nationwide.
Only around 3% of nearly 1.4 billion people have been fully vaccinated. To increase the number of doses available domestically, the government has cancelled international exports and has ramped up funding for local vaccine production. But many say more needs to be done.
Scientists have already warned the government that a third wave is inevitable. They say now is the time to prepare, by working on awareness, boosting healthcare infrastructure, and increasing vaccine supplies. Nobody wants to see a repeat of the situation the country faced when the second wave began.